We attended the Jehovah Witness service on Sunday and had the opportunity to speak with some of the elders there. However, they refused to be filmed. One of the elders explained that witnesses accept blood fractions. He mentioned that accepting blood is a personal decision of a witness. We also touched on other issues such as contraception and abortion. These views are very similar to the ones found in different religions. While contraception is allowed, the morning after pill is forbidden and thought to kill the fetus. Also, abortion is prohibited unless the mother's life is in danger. They referred us to Medical City for more information about the blood management program.
My name is Bob Bolito. I'm the Director of Environmental Services here at Medical City and also the Blood Conservation Liaison. I'm one of Jehovah's Witnesses and practice as one of the elders in the Oak Park congregation in Plano.
I'm Suzanne Moore. I'm a nurse, Bachelor of Science in Nursing, and I've been at Medical City 20 years. And my position is Blood Utilization Program Coordinator. Transfusion-Free Medicine and Surgery Program is a program that provides alternatives to blood transfusion for patients where it's not an option. So typically we see Jehovah's Witness patients coming for our program. I'm trying to reduce transfusions overall in the entire hospital.
Yeah.
I get a printout every day of the patients that were admitted the previous day that were Jehovah's Witness, and it's very rare that it's blank. So most days at least there's some outpatient visits, ER visits, and then most days we have inpatients here.
You know, I've been a patient myself, and I've had serious surgeries, and we use these techniques, and I'm here speaking, today.
I'm getting calls more and more about our program, and from other hospitals interested in starting up programs, wanting some advice.
We don't accept whole blood, right, or any of its four components. That's
which are the red cells, white cells, platelets, and plasma. But there's personal decision on the different fractions of those, and so it's up to each individual patient whether or not they would be willing to accept that. It's a matter of conscience.
Right.
We have when the patients come in, we have a transfusion refusal form with all those fractions and different procedures on it, and so they go through and discuss this with the physician, and they check whether or not they will accept or refuse each of those, so we know what they're willing to accept.
Right. Now there's some techniques that are used, like human dilution, that is acceptable to Jehovah's Witnesses, as long as the equipment being used is not primed with blood, it's primed with saline, and that is a continuous circuit.
Salvage and then hemodilution, normovolemic hemodilution, are very important for getting the patient through the surgery if they're agreeable to that.
And in fact, it's very low. So low mortality rate and a better outcome, and should live to stay.
Volume expanders, iron, folic acid, B12, to help the patients increase their red cell production. Fractions, if they're agreeable to cryoprecipitate and things like that, can be very useful in stabilizing a patient if they're bleeding.
Absolutely. Jehovah's Witnesses seek health care for even a hangnail. We're like anybody else. We want to have good health and, prenatal care, just making sure we're doing our regular visits with our family practitioner. We want to make sure that we're healthy, and we'll accept all sorts of treatment, medical treatment. And it's just that one thing. It's just that one thing because we feel it has a scriptural basis. And even with that, we'll accept some fractions, and we work with our physicians and nurses to make sure that we get the best care possible. So absolutely, we want good health care.